Senior medics have reacted with fury against the doctor, who confronted Sajid Javid over the vaccine mandate for NHS staff, calling him deluded and an anti-vaxxer's dream amid fears that tens of thousands of staff will lose their jobs over the policy. Steve James, a consultant anaesthetist on the intensive care ward at King's College Hospital, KCH, in London, questioned the government's policy during the Heath Secretary's visit to the hospital on Friday, claiming that the science is not strong enough and that he had acquired immunity through natural infection. Dr. James gave several broadcast interviews over the weekend and took to social media to urge NHS colleagues to stand up and make your voices heard if they disagreed with the vaccine mandate. The freshest exclusives and sharpest analysis, curated for your inbox email address, is invalid. Thank you for subscribing. Sorry, there was a problem. I'd like to suggest to those of you who feel you haven't had a chance to speak up that I've just had to do so. Please contact your local media outlets. Write to your executive staff at your hospital. Write to the government's Chief Medical Advisor Professor Sir Chris Whitty. Write to Boris Johnson. Write to Sajid Javid and make your views known. Please stand up and make your voices heard as best as you can. However, his stance has provoked a backlash from NHS staff across the country. Dr. Rich Breeze, an anaesthetist at University Hospital Lewisham, said, "I completely disagree with Steve James, who told Sajid Javid on that he didn't believe in vaccines. A deluded, irresponsible and dangerous intervention." Thousands of NHS staff took to Twitter with similar messages explaining why they had received both doses and a booster jab. Many said it was the single most important thing they could so to avoid being admitted to intensive care or dying from the virus. "I am an intensive care doctor. I have been vaccinated and so have my wife and teenage children. Because no asterisk, is the single most important thing I can do to avoid being admitted to ICU or dying from COVID. And because it will protect those I care about most." pic.twitter.com/ML6PSS4P7, Rupert Pearce, at Rupert_Pearce, January 9, 2022. Luton-based Dr. Meenal Viz said she felt uncomfortable listening to Dr. James's views. "I fear it will set us back," she said. Dr. Steve James was asked about vaccine mandates. He is entitled to give his personal opinions. But he didn't do that. He cast doubt on the efficacy of vaccines. Dr. James conflated his own COVID experience with an entire population's. One senior figure told I that Dr. James had been spectacularly unhelpful by challenging Mr. Javid on camera. They said, "Some of the stuff the guy said was intrinsically selfish. It was about him and his immunization status, when of course the greatest benefit of vaccinating people is to stop the transmission in others. And his grasp of immunology was pretty shabby as well. If you're boosted you have far greater protection than just having one lot of natural antibodies. It was naive and spectacularly unhelpful. I do worry about him. He might have quite a rude awakening for someone who's never put their head above the parapet before. What he said and being amplified so much is an anti-vaxxer's dream, sadly. If I was the government, this would harden my resolve to make this happen. Healthcare professionals will not be on the side of angels if they are opposed to vaccination on the one hand and then asking the public to be vaccinated on the other." The head of the Academy of Medical Royal Colleges told I that the row over Dr. James's comments is an unwelcome distraction at a critical time in the pandemic and risked hesitant staff who were considering getting the jab changing their minds. Professor Dame Helen Stokes-Lampard said, "Healthcare professionals are being so welcoming of people who are coming forward for their vaccine. There is no stigma or shame in doing so, and they will be welcomed warmly by people just keen to see colleagues vaccinated and protected, not just for themselves, but also the vulnerable people around them. This is an unwelcome distraction for the important matter of maximizing the uptake of booster doses, and we strongly encourage those who have been reluctant so far, for whatever reason, to come forward." Dame Helen said, "The worst thing that can happen is that healthcare professionals, who were a bit hesitant and considering getting vaccinated, will now dig in and not take the opportunity. That will create division and distress for many at a time when we might have been able to persuade them. We need to be pulling together, not this risks pulling people apart." The strength of the NHS has been about the brilliant teams within it and how they work together and support one another, and this sort of situation creates division and discord. The vast majority of health professionals are already vaccinated or will have legitimate exemption. For the small percentage that hold out, they will inevitably be redeployed or lose their jobs, which is a great sadness and a great waste. The Academy, the coordinating body for the UK and Ireland's 23 medical royal colleges and faculties, had been opposed to mandatory jabs for NHS staff, calling the move not sensible or necessary. Tens of thousands of NHS staff could lose their jobs if they have not had 2 doses of the vaccine by April, when the law comes into effect. Last year, the government decided all patient-facing NHS staff would need to have received their first dose of the COVID vaccine by February 3rd, and 2 doses by April 2022. Trusts will be told this week how they should go about dismissing NHS staff who have decided not to be vaccinated against COVID. On Sunday, KCH Chief Executive Dr. Clive K. said the hospital could lose 1,000 staff members if they do not get vaccinated. He said he was worried, as around 10% of approximately 14,000 workers at the hospital are yet to receive a first dose. More than 1,000 members of staff could be lost in an extreme scenario unless vaccine uptake within the workforce improves, Dr. K told the BBC's Sunday morning show. He said, "The law is now such that individuals who are not vaccinated, if they can't be redeployed, will not be able to work in hospitals if they deal with patients. We're having conversations with staff, their line managers are having conversations, we have a helpline where colleagues seek clarification and help." The number of unvaccinated staff is higher in London, where vaccine hesitancy is stronger than the rest of the country. Overall, 93.5% of NHS England staff have had at least 1 dose and 90.7% 2 doses. The figure for doctors is around 95%. Chris Hobson, the chief executive of NHS providers, said, "It is a real concern that significant numbers of patient-facing staff remain unvaccinated. Trusts are continuing to work hard to overcome vaccine hesitancy, listening to concerns, and offering clarification and support. This respectful and constructive approach has helped ensure a high uptake, but there is still some way to go, and with the NHS so stretched, even a small number of staff taken off regular frontline duties could jeopardize some services." In the coming weeks, trusts will redouble their efforts to persuade vaccine-hesitant colleagues that it is best for patients, colleagues, loved ones and for themselves to get jabbed and boosted.